So I think the press conference went well as far as the speakers, but what's sad is that as documentary filmmakers, we're the only press that was here. It's like, this is insane.
We are harming women. Menopause has the worst PR campaign in the history of the universe, right? It's just hot flashes and night sweats is the biggest crock of shit that's ever been delivered to people.
There seems to be misinformation about hormone replacement therapy. Is it safe?
A generation of women has been disadvantaged by not being offered hormone therapy.
95% of women will begin noticing perimenopausal symptoms between the ages of 35 and 45.
Now, do you have questions about anything?
We're just talking about hormones, hormone therapy. What does that mean? What does that look like?
As Jane moms, it's our mission to help alleviate suffering from all living beings.
Part of the tragedy of what happened to me, nobody treated the woman. I had to start fighting for my life right away.
There is practically no estrogen in your system.
The decline in the absence of estrogen is affecting their bones and their brain and their hearts and their blood vessels, but we're not giving them anything to alleviate that or to support the body systems.
Who am I? I know I'm not lost because I feel steady in my soul, I feel peaceful in my soul, but why is my body, why is my mind becoming an enemy to me?
Hormones.
We need to normalize this conversation. We need to talk to our daughters.
We have to teach about the journey before it's impacting us.
It's time to get the
In a household with menopause and puberty simultaneously and a hormonal circus happening, and I think I can't be the only one.
Stop trying to protect us. Tell us the truth. Hormone replacement therapy is not for everyone, and I respect your decision. But my God, you need to make an informed choice. Hi, honey.
Do I have to be on hormones for the rest of my life?
Can there be other ways, like natural ways through food?
All of a sudden, they're anxious, they're depressed, they're insomniacs. They don't know who they are anymore. They feel dead inside, like you said, Drew. Only sexually.
Soon-to-be Netflix docu-series. Balance docu-series, and you should go on their site, balancedocuseries.com, and many of us were in it trying to change the narrative on what we're living through. Because I love when Dr. Mary Claire Haber says so accurately that for anyone born with ovaries, menopause is inevitable, but suffering is not. And there is no gold star when women come to my office and say that I have a high pain tolerance and have been suffering for years. There's also nobody coming in on a white horse to save us. We are the 51%, and if we want something, we as individual women can save ourselves. And this morning was all about the first step, which is menopause literacy, right? So I was talking to the doctors on the side, like, what is the closing message this morning? Because we're about to go eat lunch, and you've had a brain full of information, and I think Dr. Casperson is right when she says that you are more powerful than you believe you are to change the trajectory of your health. So we called this little panel the hope behind the headlines. Because this morning we were telling you about your health. And Dr. Steinbaum, all of the people in your family die of heart disease. Everybody. But in one generation, my grandparents died in their early 60s because of the way they lived on the farm in Kansas. They didn't know. But my parents are 85 years old. In one generation, we've changed the trajectory of our health. And hopefully, I stay around till I'm 97 because you met Isabella and I want to be around to bug the heck out of her. But Dr. Mary Claire, what is the hope behind the headlines for women?
That is, we can change the trajectory, exactly what you said. And, the tough part for me in this whole journey is what I'm learning is there are people and institutions kind of invested in the status quo. And this is a fight. But it is a fight worth it. It is a fight that is winnable. It's going to take all of us in how we try to promote legislation, all of us in how we fight the alphabet agencies to try to change, demands for education, all of us in how we share our stories and we normalize this, and we take the shame and the secrecy out of it, so that, we can live the healthiest, longest lives that we deserve. You deserve to feel good. You deserve to thrive after menopause. And if we just kind of follow the course that's been set for us, that is not going to be our truth for most of us. We're going to have heart disease, we're going to suffer, we're going to end up requiring help and lose our independence, really. And that doesn't have to happen. That doesn't have to be done. But it's going to take, probably for most of us, changing how we eat, how we move, how we reduce stress, the burdens we take on. It's going to take prioritizing you.
That's
putting your own oxygen mask on first and prioritizing your health, then you take care of everybody else. Because who is going to take care of you? Do not dump this on the old star. Don't do it.
How do we do it though, Mary Claire? And I know you have tools on your website, and how do we talk to our doctors? What is the language?
So your doctor should be a facilitator as to what you want. You are in charge of your health care. They're not being taught, they're not being trained, they are a lever for you to pull to get what you need. You really should be the CEO of your own health care.
So, Dr. Steinbaum, my family dies of heart disease, and when I was 47, during my palpitations and getting my normal stress test from my great cardiologist, and my cholesterol rose for no reason, I was put on statins, and I was sent for one of those calcium heart tests and found that I had plaque somehow, because I've always been an athlete. How early, because some of us have daughters, some of you are much younger than perimenopause, how early do we start heart health, living from the heart?
Earlier than you all think. And that is the number one piece to this. It really takes heart disease decades to really manifest. And in a lot of ways, and we were talking about this before, we have to change the definition of what heart disease is. Right now, by the medical establishment, it is defined as already having had a heart attack, having atrial fibrillation. It is defined by being sick. And if we start defining it earlier, we are more likely to never get sick. Because the most important thing I can tell you is 80% of the time this is preventable. Now that doesn't mean that you're not taking a statin. That doesn't mean that you're not taking blood pressure medications. It means you're not sick. And the first most important thing to do, and what happened in your family, is all of a sudden the lifestyle has shifted. A lot of the research out there, a lot of the Alzheimer's research and genetically thinking was on a population that was living a hard life, not eating healthy, not exercising. We can't extrapolate that kind of genetic data to the next generation who's actually paying attention. And so the answer to everyone is understanding your risks and start getting checked as early as possible. When there is a family history, you start at 20. When there isn't, you start at 21. I mean, we waiting for? I haven't seen my book in a long time, and I wrote it long enough ago that I was like, whoa, it's time to do that again, I think. But the one thing that I remember thinking, when I was in my 20s, I lived on gummy bears and coffee. And I thought, and Snapwells. I used to talk so badly about this company, I thought they were going to sue me. Because Snapwell, it was filled with hydrogenated oils, which increases your LDL cholesterol. It is so toxic for you. But it had no fat, and back then, we were in the no fat era. So everyone got so fat because all they did was eat carbohydrates and sugar, right? And so, part of this is education, but part of this is knowing your risk. And at the end of the day, it's looking in the mirror and saying, who am I? And what am I doing to either hurt myself or help myself? It's interesting that you brought up talking to your doctor and really understanding. I mean, I think that people spend more time deciding what shoes to wear or buy than which doctor to go see, right? You need to be able to communicate with your doctor and get the help you need. And things like this, and by the way, these doctors are so awesome because our moms never had this. They never had the ability to walk into a doctor's office and ask for what they need because they're educated and they use the right language. And the first time the doctor says to you, you're fine, it's in your head, feel free to curse them out and walk away and go get it for your doctor.
I'm a sports doctor, as I've said 9 times now, and I like to do a lot of box jumping, as you've probably seen on the internet, and as I'm watching other women, lots of women, in things like, what is that competition? CrossFit. I had a menopause moment right there. CrossFit, box jumping, do you know what I see? Even the fittest women in the world have weak pelvic floors. And so something that happens, Dr. Casperson, that nobody talks about, even athletes that are the strongest in the world, is the fact that the pelvic floor is striated skeletal muscle. 1, 2, 3, go.
We all have pelvic floors. You can think about yours right now. You take a big breath and you think about where your bladder or your urethra is and you can lift it up. That's called pelvic floor down there. So yeah, we don't think about those muscles, right? And they're much smaller muscles and they actually respond to different things than a bicep. Like so many people are like, I just need to be stronger. And a lot of pelvic floor dysfunction is not from lack of being strong. It might be actually too strong, right? Think of people that have pain with sex. So it's too oversimplified just to be like, get stronger to have a good pelvic floor. There can be nuances, especially in the setting of pain. But there is data. It's a lot easier to measure a woman's grip strength because you can keep your pants on for that. Measure your pelvic floor. But there is data showing the better grip strength that you have, the less bladder leakage that you have. So there is an overall body strength that does go with pelvic floor. And here's my tip for going to the doctor. And now I know it's worked with many people. People come back to me and say they've gone to the doctor because of me. So this is what you do. You say, I've been reading about XYZ, vaginal estrogen for painless sex. Enter your thing, testosterone for libido, estrogen for bone health. Enter your thing. I would like to try it for 3 months. I will make a follow-up appointment with you, and I will check in and will adjust as needed. How does that sound? That's how you talk to doctors. Doctors love. I know, like, do a dance. You see which one works better for you. Doctors love following up. They love knowing what you've done. And I tell you, if you come back and you're actually better, they're collecting that data point. They're gonna do it on the next woman. They're gonna be like, this worked for her.
We're gonna make it easier for the next one.
Yeah. So it's very, very good, just a great way to do it. Just like tell them what you want, why you want it, and that you will follow up. Like boom, putty in their hands.
Well, and you know what? They'll appreciate that you are an educated person. Good doctors and good good doctors, and I'm not trying to bash on doctors, we have a hard life, I'm not actually kidding about that, because I don't go into that. Good doctors value patients who are not passive. Gone are the days, I was a nurse in the late 80s, when you stood up when the doctor walked in the room, and you did what they said. Those are not the way we are today.
They stood up when I walked in the room.
They did. Because you deserve that, actually. You do deserve that. But for the mere mortal doctors in the room, good doctors want you as educated as possible. You know, I like when people have read before they come to me. You know, it's why we made this article that I'm going to present to you this afternoon, the musculoskeletal syndrome of menopause, which you can get open access, so that you can download it and say, hey, I read this, what do you think about this, right? So, being informed. But here's something else that we need to communicate about, because I'm going to tell you for sure, as a former cancer nurse, breast cancer nurse, nothing strikes fear in the heart of a woman than thinking that we are going to be killed by our breasts. And so, what age do we start caring about breast health? What age do we start thinking about them as more than a sexual object or something we feed our babies with? They are medical organs. Tell us how to take control of our breast health.
Well, I think ultimately it's just a piece of our larger health. It's right along with our heart and our mind, the rest of our bodies. And so if we really want to take a bird's eye view, I think it starts with educating mothers on feeding their children, how to guide the lifestyle of your children. Because as we talked about in the last section, breast health is very tied to the way that you live. It's a very lifestyle-related cancer. 5 to 10% of breast cancers have a genetic link. That's it. So when it's running in a family, we usually don't find a related gene. But what else runs in a family? Way of living, right? And so, and even those with the big, we hear about the BRCA gene, you have control over the expression of that gene via the way that you live. If you are on your game, you're eating a plant-based diet, you're working out, you're keeping your body weight in check, you're not drinking, you're sleeping well, you're responding to stress rather than reacting, all of your things are in check. You can keep those genes from being expressed. And so I found more than a handful of 70, 80-year-old women who present with their first breast cancer at the age of 70 or 80, and we find the BRCA gene in them. And I'll say, what was your life like? And they generally had a pretty healthy life. So even if the gene is present, we have some control. So when do we start screening, is what Dr. Wright is asking. Well, the guidelines say 40, that's when you start getting mammograms. But if you have it in the family, whether it's genetic or just the way that, life has been, you start 10 years before whenever the relative was diagnosed. But I think it's a much bigger thing. I think it's an information thing. I think, it is important for us to make these decisions our entire lives, and that's going to depend on our healthcare system changing, our education system changing, our food system changing, pharmaceutical industry changing. It depends on a lot, and that's a lot bigger than any one person. But we can take control of our own health and the health of those in our immediate vicinity today.
Absolutely, that is the whole message of this panel, is that you are in more powerful control. And you know what I have to say, I am really sad that in addition to alcohol, which I don't drink anymore for all the reasons, and plus also orthopedic women get 5 times the rate of breast cancer as other women because of the x-rays we're exposed to. So those are my reasons. I was really sad about the bacon news. Really sad. So as we wind down, lunch is out there waiting for you, and I was going to comment on I'm going to ask each panelist to give you their really best advice. We talked about how to communicate with your doctor, to take control. My husband, for 2.5 seconds, was in the room, and we've done a podcast on how to communicate with the people in your lives about what you're going through. I can't believe he stepped out before I got to embarrass him. But give us your best advice, your short advice on how do I approach these subjects with the people I love in my life.
I think the silent approach works best.
The silent approach?
You do it, you model it, and they watch and they follow.
That's interesting. Dr. Casperson?
If you have a man in your life, you say, if men's testicles fell off, there would be a national vaccine. You have to use language that they understand.
Oh, Dr. Steinbaum.
That is just too funny. It's hard. You know, I think that for so many years, I've seen patients come in with their wives who've been taking notes for them and taking care of them, where they silently suffered. And I really think that there has to be an understanding in all families that mommy has to come first sometimes. And really having that conversation around what their own personal self-care is and why it matters. And I think honesty, especially with your partner, your husband, your mate, is really important because the previous generation didn't do that. And I think they really, really suffered. And seeing the divorce rates and exactly around what time that happens, let's face it, a lot of hormones have possibly something to do with it. So having that conversation might save your marriage, save your life, and teach your kids something about what it means to put yourself first.
That's great. Dr. Mary Claire.
So my husband's affectionately amongst his peers almost remarkable. And he kind of went through this journey with me. I was just as disillusioned and ashamed and secretive about my symptoms. But the best, so he's kind of grown with me through the process, and he's happy to speak about menopause now. It's no big deal, but he's very special. And he has 2 daughters only, so, he's just been thrust into this. His mother never talked about it. It was, my mother didn't know for 10 years. So now the best patient visits I have are when the doctors are with them. And I'm able to tell them at the same time what to expect, what's going on, what our treatment protocol is going to be, and all the lifestyle changes that have to happen in order to get her, where she needs to be in functional. And that, just being, when you have a dedicated partner, when they are willing to go through, this is not your fault. You can't control what's happening, and it is happening. And, bringing your partner along, and I think that is also a reason for the divorces, is that people who just want things that are always going to be the same and aren't willing to accept the changes in you. And I have a couple patients who are divorce attorneys, and they love to talk about this. And, and I think also, our ability to prioritize ourselves becomes a necessity. And all of my ex walked out the door with menopause. I'm not afraid to say what I want, what I need, lean into that power. And I think that's some of the cause of the divorces. Finally, you put yourself first. They're not going to go there with you. Okay, bye.
I love all this advice, and I see that my partner in crime has walked in the room, and if you want to hear Peter Tagliane's advice on how to live with a menopausal woman, we did a podcast because,
No, you don't.
He is the reason that I'm capable of doing events like this, by doing more than 50% of all the work in our lives. But in learning about this, I agree with Mary Claire, is you have to bring whoever loves you along on this journey with you, because otherwise you sit lonely in the dark, in your pain, and they love you. And if you talk to them about, this is what I'm feeling, this is what I'm experiencing, they too may become experts like Mr. Haver and Mr. Taglianetti. So we are going to adjourn now, hopefully with you feeling empowered, and I want to hear raucous conversation out there as you're eating all the delectables that we've provided for you. And we will see you back, hold on, don't be late because we're starting right on time. We will see you back at 1:15. Thank you so much.